So are Michigan hospitals ready to handle Ebola? New at 6, 24-hour News 8's Joe LaFergie went one-on-one with a top state health official to get some answers.
Even though we haven't had a case of Ebola here in Michigan, state health officials are dealing with the crisis on two fronts. First, making sure healthcare professionals like doctors, nurses, and first responders are ready should a case happen here in Michigan, and dealing with the public's fear. In hospitals and other healthcare facilities across the state, the what-if scenario plays out.
It really revolves around asking appropriate questions and taking the appropriate precautions.
Dr. Matthew Davis is the state's chief medical executive. Michigan takes an all-hazards approach to identifying potential public health risks. Policies and procedures are in place to identify the pattern of a health hazard, like the flu. And that's just one of the many challenges brought on by the Ebola scare. Teaching healthcare workers how to separate symptoms of the more prevalent influenza viruses from Ebola in the ER. Davis says the key is in the follow-up.
Was someone in a place like West Africa or with somebody in close contact who is known to have had Ebola?
And while there's been no reports of Ebola in Michigan, the state's monitoring system is watching for the signs. The syndromic surveillance system is a network of more than 90 healthcare facilities statewide, mostly hospital emergency rooms, which uploads patient information to a state database monitored by the Department of Community Health.
That's how we knew, for example, that back at the beginning of September, Labor Day weekend, we were all of a sudden seeing this rapid increase in the number of children coming in with respiratory symptoms, breathing problems. That turned out was the beginning of our enterovirus D68 outbreak.
While Davis is confident Michigan is ready, the apparent missteps in Dallas and elsewhere has many asking, can we trust the system? Davis says Michigan has learned from mistakes elsewhere, so the emphasis has been on getting information out to healthcare providers on spotting Ebola and protecting their workers and the general public.
Our goal and our responsibility at the Department of Community Health is to make certain that our partners across the state are aware of those lessons learned.
Of course, one of the best ways to deal with the fear is through information, and we have all kinds of resources on our website at woodtv.com. In Lansing, Joe LaFergie, 24-hour News 8.